Welcome back to the Michael Brooks Show. Joining us now is esteemed, sometimes co-host and contributor. She's an executive producer and personality, Artesia Balthrop.
Hi, guys.
Welcome back. We missed you.
I missed you, too. I'm glad to be here and really looking forward to the live show.
The live show in Philadelphia, November 23rd, World
Yeah.
Cafe. Buy your tickets. People loved you. Do you realize that?
I mean,
The feedback from your first appearance was like,
they said
relentless
that I was a
positive.
star, and I appreciate it. It's just the ego boost I need to get me out of bed in the morning. So thank you to everyone out there.
they're just recognizing the truth.
It's okay. I have a great outfit ready for the 23rd, so you guys show up and see it.
I have no doubt. Waz and I actually talked about that. We're like, wonder if how much time Artesia's cooking up for the outfit.
Really? I just, got to be on brand. Very, very classy and a little pop of color.
Absolutely. That is exactly how I would describe your brand. Let's go to David Griscom. We missed you last week. He was in Spain. He was like, yeah, man, I'm on the street. I'm getting drunk. Here he is with the gem, the Griscom Economic Minute. David, what do we have?
Well, this one's, it's definitely a little bit of a difficult subject. I really wanted to be able to talk about the medical debt crisis that we're facing in this country. We talk a lot about Medicare for all, a lot about wage stagnation, but this is really becoming a major issue for many people and has been for decades. But in the past 15 years, it has really exploded and is affecting so many families. So a 2018 Health Affairs study that analyzed 2016 data found that 1 in 6 Americans have past due healthcare bills, $81 billion overall. Now, this is really important, and a lot of neoliberals use this actually to discredit the crisis of the medical debt crisis. 53% of those bills are for less than $600. But we talk about this all the time. Most Americans don't have $1,000, set aside for medical emergencies or any kind of emergency. So for many people, especially working people, this can be insurmountable. And if we know anything about debt collectors and just the function of debt in the U.S. economy, these missed payments can really start adding up very quickly. Right. And, insurance itself won't save you. With many people, their deductibles are $1,500 a year, which is a lot of money for most people. 81% of policies in the United States have deductibles, and the average deductible is $1,500. And oftentimes people, especially more low-income people, have to have very, very high deductibles. So as anything as sad as it is to say in the US, whenever there's tragedy, there's opportunity, and debt collections overall is an $11 billion a year industry. And the way that the system works is it really encourages anyone who is a creditor or a debt collector working on behalf of a creditor to really hound people. Because basically the way that it works is whoever gets there first is going to be first in line to get the money. So that's why, if you've ever noticed, if you've ever been in this situation where you have a debt that's like $100 and you have a creditor like banging down your door for $100, it's because the system actually encourages them to really push forward, because if they get in the back of the line, they're very unlikely to be paid. So when we're talking about this, we have to recognize the fact that 66.5% of bankruptcies around the United States are caused by medical debts. That's around 530,000 families that have been devastated by medical debts. And I bring this up, and I was really thinking about this because I was reading a really harrowing piece in ProPublica that everybody should read called When Medical Debt Collectors Decide Who Gets Arrested by Lizzie Presser. And it tells the story, focusing on a small town in Kansas near the Oklahoma border, of a lawyer who is working on behalf of a lot of different creditors, but mainly the local hospital, to harass and harangue folks who are in debt because of medical bills. A lot of times these are for smaller bills, around $600, but oftentimes, these are for families that have just been devastated by tragedy. There's one family where a working man had his wife dying of cancer, and their son also had cancer as well, and they racked up massive medical debt. And what's really harrowing about this story was that the lawyer was basically encouraging the judge to use their powers to hold the debtor in contempt of court, which means they put them in prison. And then when they get out of prison, the judge was applying the bail payments to the debts. So people were being forced into prison for, sometimes around $500 to $600, but sometimes for smaller amounts. And this is a very economically depressed area where a lot of people really are living paycheck to paycheck. And as we've talked about so many times on this show, many Americans really are living in that reality. So it's a very frightening, development. And of course, this is also something we should recognize too, that this coming after low-wage workers, coming after poor people is something that has been growing across the country in the legal system. We hear horrible stories of people being sent to prison for unpaid traffic tickets, etc. So this is something that's not just unique to medical debt, but something that's just so cruel when you see that these are people who are just really struggling to get by. There's no way that we can say that we live in a just society where people are being harassed in this way and being sent into prison. We know that the GoFundMe is a really horrible example of how many people are really struggling to get by and under medical debt in this country. I just wanted to add, two quick things. This kind of exploitation, we talk a lot about the exploitation of bosses to workers, but this is the second level exploitation. And you can go back to Marx in the manifesto. He writes, no sooner is the exploitation of the laborer by the manufacturer over, that he receives his wages in cash. Then he is set upon by the other portions of the bourgeoisie, the landlord, the shopkeeper, the pawnbroker, etc. And this is something that's very important because when we're talking about discipline, the way that the bourgeoisie, the ruling class, tries to discipline the working class, debt is a massive part of this because these are people who are already in difficult situations. You can imagine people who are working full time, who are not making high wages, are being highly exploited. And this is a great way for the people in power to be able to keep those folks down. So this is obviously an important example of why we need Medicare for all in this country. But also, and this is why it's so important to support Bernie Sanders, why Bernie Sanders' plan to eliminate medical debt, that $81 billion that I talked about at the beginning of the segment, Bernie Sanders has a plan to eradicate that medical debt and to alleviate people from this horrible suffering that they've been going through. And also, it should be noted too, to get rid of the private credit industry and replace that with a public credit rating industry, which would be huge for a lot of other reasons, but most definitely for this. It's not enough just to rectify the wrongs in the future. We also have to do as much work as we can to repair the damage that the past has caused.
100%. It's kind of amazing to just sit like, he's putting on the table complete student debt relief and complete medical debt relief. Those two moves alone, the amount of suffering that would eliminate and the amount of huge activity and liberation in the economy is mind-blowing. I mean, those two steps alone put him in a completely different category, and it's incredible to reflect on the significance of that. I know people are all touched by those issues.
No, they are. And I really highly suggest people taking a second, though, to read this ProPublica piece, because a lot of times when we talk about these issues, we talk about numbers. And when you start to read the personal stories, I mean, it makes these fights so much more real, as they should be, because these are things, as you said, that affect so many people, and they affect us in many different ways. And it's important to have that, human aspect in the struggle as well.
Absolutely. Artesia.
Yeah, I
How
mean,
you doing?
No, I
thoughts?
just wanted to add, it's not just our low wage workers; it's also our barely middle class workers who will never be able to see their full wage because they're trying to pay off debt. Personal anecdote of a friend of mine who had to have life-saving surgery and got scared of the debt collectors who were calling her. So she transferred all that debt to a credit card. And now the interest on that credit card has doubled that debt, and she can't get a personal loan in order to pay that, to transfer it off. So I've just been really educated on how so many vultures come after people with medical debt, not just the medical debt collectors, but then you get the creditors and or the credit card companies as well get to profit off of people's medical debt. And so now this person who makes, six figures, which everybody would celebrate, can't see that wage or see any of her income really is going straight to credit cards. So everybody's eating except us.
Everybody's eating off disease. You just watched a Michael Brooks show video. Subscribe to get them all. Why wouldn't you? Don't be foolish. Click subscribe below and become a patron as well. Patreon.com/TMBS. Thanks, everybody.